A temporal brow lift is a less aggressive form of a brow lift that involves removing extra scalp tissue along the temporal region of the scalp. So essentially it only serves to elevate the lateral eyebrow a little bit. And it elevates the lateral eyebrow a little bit by removing some scalp tissue in this region here. And by removing that scalp tissue, it pulls the forehead and eyebrow up a little bit in that area to create a subtle elevation of the lateral eyebrow. Now, when any brow lift is done, we always elevate the lateral eyebrow more than the medial eyebrow. But we have to do this tastefully, otherwise you look very odd. So when we do a temporal brow lift, we only elevate the lateral tail of the eyebrow because that's all a temporal brow lift can do. But when we do other forms of brow lifts, we still preferentially elevate the lateral eyebrow more than the medial eyebrow because the lateral eyebrow falls more than the medial eyebrow with aging. So in every type of brow lift, the lateral eyebrow is lifted more than the medial eyebrow. With a temporal brow lift, it only can elevate the lateral eyebrow a little bit because it is just not as powerful as the other brow lift techniques. So if you have a very mild amount of brow ptosis or low eyebrow and only the lateral tail of your eyebrow needs to be addressed, a temporal brow lift may be a solution. The temporal brow lift doesn't require any internal fixation because the scalp tissue removed in that area creates enough tension to hold it in place without having to fixate it to your skull. Temporal brow lift does not require any drains, and the resulting scars are scars that are somewhat horizontal in this direction along your temporal region because that is the dimension we have to pinch out that skin in a temporal brow lift. In my experience, there are very few patients that come to me who are good candidates for a temporal brow lift. Either their brow ptosis isn't bad enough to justify a brow lift at all, or their brow ptosis is severe enough that if we're going to treat it, we should use a more aggressive and reliable approach or treatment option, such as a forehead lift, coronal brow lift, or endoscopic brow lift. There are a small subset of patients for whom a temporal brow lift is a good solution, but I find that they are the minority of patients with brow ptosis. To learn more, check out our website where you can upload your photos and concerns as a virtual consult. You can also check out our price estimator to get pricing information for all the various procedures we offer. And finally, if you'd like to have your questions answered on a future podcast or Q&A video session like this, please leave a message on our SpeakPipe. You can go to our blog page and our SpeakPipe is located there. Thanks for listening.